Hello, Dr. and friends. My name is Putri, and today we will talk about palliative care in HIV patients. We are from Small Group Discussion D6. And this is our team member. For the first one, we are going to talk about the background of the student project. Now, human immunodeficiency virus, or HIV, is one of the most common diseases that can be found worldwide. Deficiency of patients' immune system makes the immune system weaker against HIV, and patients become more vulnerable to other diseases. The mortality rate in patients with HIV is still high because of many factors, such as financially inadequate coverage for treatment, malignancies, aging process, and organ failure. Researchers began focusing on improving one's quality of life and managing symptoms including pain, mental disorders, and spiritual status for HIV patients that are reaching their end of life. Improving patients' life can be done by palliative care. Now, systematic review of palliative care in patients with HIV also shown that outcomes can be improved by early integration of palliative care. Next.
So for the problems and objectives, for the problems, it consists of what is palliative care, what is the principle and policy of palliative care, what is the consideration for palliative care, what are the importance and methods of palliative care in HIV patients, how is the evaluation of people living with HIV, what is the importance of family support in HIV patients in the palliative stage, how is pain and symptoms management in HIV patients, how is mental health management in HIV patients, what is the planning for palliative care in HIV patients, and what are other therapies to support palliative care in HIV patients. And for the objective is to understand the answer to all the problems that have been said before.
My name is Christian Bastian Talo, number 075. Palliative care in general is a specialized medical care which aims to optimize the quality of life of the patients and the family and alleviate the suffering of patients. Palliative care is targeting the physical, psychosocial, and spiritual life of the patients with life-threatening disease by an interprofessional team approach. Thank you.
My name is Angel Fasan Chavez with the last digit of student number 091. I will be explaining about the principle and policy of palliative care. Sensitivity, empathy, and compassion are all characteristics of caring attitude. Non-judgmental loving attitude is also required, in which personality, intellect, ethnic background, religious belief, or any other individual characteristic do not preclude the provision of best care. Individuality is also taken into account as a principle of palliative care. This is necessary because categorizing patients by their underlying condition based on the universality of medical problems faced ignores the psychological features and concerns that differentiate each patient as a unique individual. These distinct traits can have a substantial impact on suffering and must be considered when developing palliative care plans for specific patients. Relatives of patients receiving palliative care experience a lot of emotional and physical anguish, especially if the patient is being cared for at home. The ability of carers to cope may determine whether palliative care succeeds or fails. Thus, extra attention must be paid for their needs. And ethnic, racial, religious, and other cultural characteristics can have a big impact on how much a patient suffers, because cultural differences must be acknowledged and treatment must be organized in a culturally sensitive manner. Palliative care must also take cultural issues into account. Palliative care concepts include consent, communication, and the choice of care location. Appropriate therapy, which includes comprehensive interprofessional care, continuity of care, consistent medical care, and advanced care planning is required in a clinical setting. This can help palliative patients avoid crisis and receive coordinated care.
My name is Putri Sebastian and my student number is 143. So I'm going to explain about general consideration of palliative care in HIV patients. Most of the HIV patients are older than 50 years old and have comorbid diseases like liver, renal, or cardiovascular conditions. These conditions that he or she had lead to physical and emotional symptoms like pain, nausea, fatigue, vomiting, depression, and anxiety. The second, psychosocial suffering like stigma in community, and spiritual suffering. Other than that, ARV, or we can call it antiretroviral, as a primary or curative drug, can delay death to occur and may give toxicity effect to the patients. So, palliative care as a multidisciplinary approach may be considered to be implemented in HIV patients so that the patients can reduce their suffering and increasing their quality of life.
Hello, my name is Leonardo Alpedias with the last digit number 120. Importance and methods in HIV patient palliative care. Palliative care plays an important role in relieving and reducing symptoms in patients with HIV/AIDS, including pain, cough, diarrhea, nausea, shortness of breath, fever, fatigue, weakness, confusion, etc. Without palliative care, there will be increase in accidents of undue suffering and frequent visits to clinic or hospital. Method of palliative care is focused on preventing suffering and delivering relief to symptoms. Several types of palliative care intervention include physical, emotional, social, and spiritual. Thank you.
Hello, my name is Christopher Udayana, number 153. Now I will explain about the initial evaluation of people living with HIV. So essentially, HIV can be detected in the human body via antibody or virus detection, but at the moment, the antibody detection is the preferred initial evaluation. ELISA may be used to detect HIV antigens after 3 to 5 weeks of infection. When diagnosis of HIV is confirmed, stratification of stages must be done to determine accurate management. According to WHO, there are 4 clinical stages of HIV, where clinical stage 1 is the most mildest and clinical stage 4 is most severe. The clinical staging of HIV use serves as a tool for risk stratification of morbidity and mortality. Terminally ill HIV patients may choose to undergo palliative care to boost the wellness of their remaining lifespan.
Good morning, doctor, and good morning, fellow friends. My name is Nuko Pratno with student number 076, and I will explain about the family member and caregiver support in the patient with HIV stage palliative. Family supports have a role to increasing the quality of life of HIV stage palliative patients, where a study from China shows result that more than 90% patients who receive support from their family has better quality of life. Support from family help patients with HIV to obey their medications, in this case, antiretroviral medications. Family support also play important role as a support system in the financial, psychological, and physical area, where mostly patients with HIV are not ready for the diagnosis. Family support was common for the patient with HIV in any region of the globe. For example, in Turkey, acceptance and support for HIV patients from their family, like parents, spouse, or siblings, are very high and common. 75% of HIV patients that being studied describe their spouse as supportive and very supportive. It is a great news for HIV patients so they can cope with their fear, where 61% of the patients have a fear of being shunned by their family. That's all. Thank you.
My name is Putri Ariani with student number 217. So today I'm going to be talking about the pain and symptoms management in HIV patient, especially when it comes to the palliative care. So the pain management for HIV patient can be assessed by looking at the characteristic of the patient's pain. And this characteristic is including the pain intensity, the type of pain, the pain reliever, and the pain interference. And the following here is the WHO classification of pain management in HIV patient. And if the pain is mild, we can just use the non-opioid drugs such as an NSAID. You can see the dose here. And if the pain is moderate, we can use weak opioids and can be combined with the non-opioids. And this just same as the mild pain. And for the severe pain, we should use strong opioids such as oral morphine, and the dose is here. And for the symptom management of HIV patient, and the patients themselves may encounter a variety of symptoms involving the several important system of the organs. This is a result from the malignancies, infection, the infection from the HIV itself, and substance administration or drug toxicity. And when appropriate, the situation that caused the particular symptom, as like here, should be managed And for example, from cryptococcal meningitis, and as this is an emergency, and so it's crucial as treating the symptom itself. Yeah, for example, you can take codeine or loperamide to treat chronic diarrhea that are not caused by certain pathogen.
Hello, my name is Putri, my number is 010, and here I would like to explain to you about the mental health management in HIV patients. So when compared to the general populations, rates of mental health disorders are higher among both HIV-positive people and people living with HIV. It can impact directly and indirectly. So mental health issues plays a significant role in HIV transmissions in all groups, increasing the chance of infection by 4 to 10 times. A study found a bidirectional relationship between depression and the immune system, and it is known to negatively affect the immune system, and depression has been shown to increase the risk of mortality among people living with HIV. So given the significant evidence that the mental health and behavioral disorders contribute to poor HIV health outcomes, mental health treatment and care are clearly needed. There are a variety of effective mental health treatment available, including psychopharmacological treatment, various psychotherapies, stress reduction, mindfulness treatment, and harm reductions to advance the provision of mental health care. And one of the examples of additional interventions is internet-based mental health intervention, such as internet-based cognitive behavioral therapies, which are at the moment gaining traction around the world as a way to improve access in low resource settings and among youth and young adults who are at high risk of non-adherence or lack of access to health mental resources. Thank you.
My name is Johanna Rena Bunyamin with student number 150, and now I will explain about planning of palliative care in HIV patients. Antiretroviral therapy is very helpful to increase the quality of HIV patients' life, and of course, it helps to reduce the mortality rate. But somehow, at the end of the life, some obstacles such as inadequate treatment coverage, aging, organ failure, and malignancy should be taken care. In HIV, palliative care is a key to optimal medical management. Due to stigma and social isolation, HIV patients prefer to undergo treatment at home. Palliative care that can be given is a mix of psychosocial support, traditional remedies, and medicine. Palliative care guidelines for HIV patients have to revert to the national guidelines for clinical management of HIV.
Hello, my name is Pratna, with the number 115. So for the other therapy to support palliative care in HIV patients, there are two types: the psychosocial, spiritual, and also support system of life care. People living with HIV, the psychological and also spiritual support critically important for coping with the overwhelming feelings and the threats of death. Psychological support helps people living with HIV to adapt to the disease and its complications. People living with HIV should disclose and involve in the talking to get support from his family, peers, and support groups. A multidisciplinary team is needed to address various concerns of people living with HIV. Psychosocial support for people living with HIV should also address finance, housing, and assistance with daily living. Spiritual support helps them to understand the meaning of life and improve belief and their faith. Spiritual support is also considered as resources for self-managing for these category populations. And last, preparing for that starts with an effective communications with the family. Starting to talk on discussing concerns has both the family and also the patient's will, care of families, and related costs. Discussing sensitively about dying and grief reactions is an important aspect of care for people living with HIV and their caregivers. Thank you.
My name is Nuna Hatifah Depataraja with student number 136. As a conclusion, palliative care for HIV patients is essential to improve patients' quality of life and their family while facing the problems, and to reduce unnecessary burden on hospital with an interprofessional team. Palliative care that can be given is a mix of psychosocial support, traditional remedies, and medicine. Pain management can be assessed based on patients' pain characteristics. Mental health treatments in HIV patients may include psychopharmacological, psychotherapies, stress reduction, etc. Other therapies that may support palliative care in HIV patients are psychosocial support, spiritual support, and support related to end-of-life care. Next. Okay, that's all from us SGDB6. Thank you for your attention.